Congressman Giarrusso, thank you so much for being here today with us. My name is Pat Martin, and I'm a volunteer advocate with the Alzheimer's Association. And Alzheimer's has unfortunately touched my life way too many times, which I'll give you a little more information in a bit. And I want to hand it off to my folks that are here today also to talk to you.
Hi, Congressman Giarrusso. My name is Michelle McKeno, and I live in beautiful Montara on the San Mateo County coast. Our father had dementia, and I'll tell you a little bit more about myself a little later on. Thank you for having us.
Of course, thank you.
Good afternoon. My name is Jennifer Fink. I have 3 generations of women on my mother's side that had one form of dementia or another. My mother passed away from Alzheimer's in 2020, and I live in beautiful, bountiful Brentwood, California.
Great, thank you.
Hi, Congressman Giarrusso. My name is Ashley Maldonado, and I also, as my partner says here, that I have Alzheimer's in my family as well, and I live in beautiful San Gabriel, California.
Great. Well, thank you all so much for taking the time to meet with me. Really happy to meet with the Alzheimer's Association today. This is every year one of my most meaningful meetings, so I made sure to wear my purple t-shirt for today. When I was first elected to Congress, I didn't have a personal connection to the disease, but unfortunately this last year my grandmother was diagnosed with dementia. So really excited to learn about what you all are going to be talking to me about today.
Congressman, I'm so sorry to hear about your grandmother. As we know all too well, this disease is a disease of the family. It doesn't just affect the person who has the disease, it affects everyone around them. And I want to start by talking about where we really need your help. And it's an appropriations request for another $289 million for the NIH for research funding. And we've been very fortunate. You've been very supportive in the past in supporting appropriations increases for Alzheimer's research funding. And we are still playing catch up. We didn't put enough money against Alzheimer's research. And, it's been proven that like we've seen with cancer and like we've seen with AIDS, that if you put the money against the research, the answers will come. And we're starting to see the answers. The funding that we've already gotten, thanks to your help, has made a difference. Now we're starting to figure out early on in the disease, even before the symptoms start, that somebody can have it. And I just think about the fact that in my life, as I mentioned before, this disease, my grandmother first got this disease. I didn't know really much about it, but it came and hit me full force when my husband got the disease. My husband got an atypical form of Alzheimer's disease. He was in his 50s. We had twins that were in middle school at the time. It took him 4 years to be diagnosed, and there was no hope for him. He died 10 minutes shy of his 64th birthday. So now my mother has Alzheimer's disease. So I've got my grandmother, I've got my mother. And for me personally, I don't want to be like my mother is today and not be able to recognize the picture of her latest great grandchild. Because this disease is a specter for me as well. And right now we've got 6 million people with this disease. We really need to get a life for people, a hope for people, a survivor of this disease. So, it's the only disease we got right now in the top 10 that doesn't have a way to cure it or a way to treat it. Mm-hmm. So we'd really appreciate to have you lend your support and give your support to the chair and ranking member of the Appropriations Committee for $289 million more in Alzheimer's funding. Would that be possible?
Yeah, well, thank you so much for sharing your story, Pat. In years past, I've supported Alzheimer's Association funding for the NIH, so this seems like it'd be an easy one to support. Just make sure that my staff gets the appropriate materials so that we can review them.
Absolutely will. Thank you so much. And
Great,
next I'm going to pass it off to Michelle.
Thanks so much, Pat. Our father had dementia and passed away about 11 years ago. And working in health services for over 30 years, particularly with older adults, I saw the effect of dementia and Alzheimer's on the community. We urge Congress to continue its commitment to addressing Alzheimer's and other dementias by fully funding the Building Our Largest Dementia Infrastructure Act, or BOLD Act, providing $20 million in fiscal year 2022 will enable the Centers for Disease Control to award additional centers of excellence that focuses on important priorities such as tribal health, and expand the number of state, local, and tribal public health departments that receive grants. And as Pat said, nearly 6 million Americans are living with Alzheimer's dementia, annually costing about $355 billion just in 2021. African Americans, Latinx Americans, and women are particularly at risk of developing Alzheimer's and other dementias. And about 1 in 3 Alzheimer's caregivers report their health has become worse due to caregiving responsibilities. There's a growing scientific consensus that concluded that healthy living can reduce the risk of cognitive decline and may reduce the risk of Alzheimer's. Public health departments can integrate brain health messages into existing and relevant health campaigns. Over the last year, we certainly have witnessed the impact of public health education related to the COVID pandemic. And additionally, we've seen the effectiveness of public health anti-smoking campaigns in the community. I'm asking you, Congressman Giarrusso, to support your support for $20 million in fiscal year 2022 to build the capacity of our state and local public health departments to address Alzheimer's and other dementias. And I'm wondering today if we can count on your support to fully fund the BOLD Act in 2022.
Well, thank you again. Thank you, Michelle, for sharing your story and more information about BOLD funding. I seem to recall supporting something like this in years past. Is that right? This builds off of that work?
So yes, Congressman Giarrusso, the BOLD Act did authorize $20 million for 5 subsequent years. And we're asking for $20 million for 2022 to support public health departments throughout the nation.
Yeah, well, I know public health definitely needs additional resources to do this type of work. So I'm excited to support this as well. Just again, make sure that my staff gets the information and we'll review it.
Absolutely. Thank you so much for the time.
And now Ashley is going to talk a little bit about another critical area of help we need from you, Congressman.
Hi, Congressman Giarrusso. My name is Ashley, like Pat said, and I want to ask you, my ask is to ask you to co-sponsor the Comprehensive Care for Alzheimer's Act. Healthcare utilization is significantly higher among seniors with dementia and Alzheimer's. I can attest to this. My grandfather, last month, he was hospitalized 3 different times, and within the span of 2 weeks, because it was really, really hard to get a team involved to figure out what was going on. And to be honest, the annual hospitalization rate is twice as high. And the use of skilled nursing facilities and hospital stays is almost 4 times longer for people with dementia. So this act, basically what it offers is proper care for those diagnosed with dementia. It will include better coordination of care, seamless navigation across the multitude of providers, and timely access to care and interventions. So basically, the Center for Medicare and Medicaid Innovation, or the CMMI, funded dementia care management pilot projects in the past decade. And they actually demonstrated that managing the care of people with dementia can reduce hospitalizations and emergency department visits, and improves not only the outcomes of the patients, but it reduces the total cost of care. So it's a bipartisan act, and basically it will end up providing services such as development of a care plan, care coordination, navigation, education, and support for caregivers. And we could really, really use your co-sponsorship on this act. on this bill.
Absolutely. Well, thank you for sharing this this new measure with me. Do you have a sense of how much it costs? I know some of my colleagues in Congress really care about whether or not something's budget neutral or expanding the deficit. So it'd be great to know if you have a sense of the cost.
To be honest, I do not have a sense of the cost, but I am sure that our staff can be able to help that and answer that better than I could.
Great. Well, it seems like something that makes a lot of sense, and I'd love to learn more about that cost question as well.
Absolutely. Thank you, Congressman.
Okay, next, Jennifer's going to talk a little bit about help for caregivers, something very near and dear to my heart.
It's very near and dear to my heart as well. As I mentioned earlier, I come from 3 generations of women on my mom's side of the family that had some form of dementia. As I said, my mom had Alzheimer's. My maternal grandmother had vascular dementia. And I'm not entirely certain the kind of dementia my great grandmother had. She passed away before I was born, which, as you can tell, was yesterday. So caregivers get thrust into caregiving. We kind of refer to it as the Tuesday emergency phone call that upends your life. And we're here today to ask for support on the Alzheimer's Caregivers Support Act, which was introduced by Senators Amy Klobuchar and Senator Susan Collins and Representative Maxine Waters and Chris Smith in the House. And this legislation would authorize grants to organizations like senior centers, state health agencies, to expand training and support services for families and unpaid caregivers of those living with Alzheimer's disease and other dementia. And this is extremely crucial because, as I mentioned, many caregivers, probably the biggest percentage, are clueless as to what Alzheimer's is, what the progression looks like, what's going to be expected of them coming down the road. You know, it's easy in the beginning and it just gets harder and harder. And I have referred to it as being sort of sucked in like quicksand. And I am in a unique position that I talk to lots of caregivers in the thick of things. We've got millennials that are not working because they're taking care of a parent or a grandparent. We need to do stuff to help caregivers get through this very large, challenging, unpaid, life upending event.
Well, this sounds extremely relatable given kind of my family's experience now in the last year. So I would love to, if there's an opportunity, I don't know if this is a 1-for-1, Democrat, Republican sign on, but if there's opportunity to sign on, I'd love to.
Thank you. We appreciate the help, and I hope this is the beginning of more to come.
Absolutely.
Well, Congressman, I want to thank you again for taking time with us today. I know that we will follow up with more information with respect to the cost. Some of these bills have not been scored yet, but it costs. Out of our Treasury right now, we're spending $239 billion in Medicare and Medicaid funds for Alzheimer's. So I have a feeling that once we look at the scores on these bills, it's going to pale in comparison to $239 billion and help a whole lot of people. So I was wondering if you had any more questions.
No, I think that's it. It's a big you all have a big platform this year and a lot of asks. So it's just so exciting to see all the ways the Alzheimer's Association is trying to help folks in my district in California and throughout the nation. With the pandemic, I think we've seen the impacts of COVID really impact families that are caring for those with dementia and individuals living in long-term care. So, it seems like you all are thinking really hard about those impacts, and these proposals seem to really hopefully hit the mark on how to help people. So glad that we were able to have this discussion and really looking forward to finding ways to support these.
Great. And would you mind if we took a screenshot, because we would love to tweet this out and get it out, because we so appreciate your time.
Absolutely. Yeah, I would love to get the picture. And then can you make sure that our staff gets it so that we can post it on our social media as well?
We definitely will. So, okay, everybody smile. Thanks so much, Congressman. Have a great day.
Thank you. You all too.